the function of fibrous pericardium. So okay, now let's discuss it. It protects, anchors and restricts. Protects. It acts as a protective barrier, shielding the heart from infection and physical trauma. Anchoring it helps to keep the heart fixed in its position within the chest cavity and prevents it from over distending. Okay, restrictions. It limits the heart's movement and prevents it from overfilling with blood. Okay, the base of fibrous pericardium. It is same as the base of the heart. It is continuous with great arteries and veins. The arteries that leaves and enter the heart, uniting with the advent of these vessels. Okay, the fibrous pericardium continues ventrally into two main ligaments. Sternopericardiac ligament. It attaches fibrous pericardium to sternum, as you can see from the name Sternopericardium ligament. It attaches the fibrous pericardium to the sternum. It's simple. Phrenopericardiac ligament. Phrenopericardiac ligament. Now it's a comparative anatomic point. Okay, it is present only in the dogs. It joins the fibrous pericardium to the diaphragm. It's only present in the dogs. Okay, remember the serous. Now let's go to the serous pericardium. It is thin two-layered membrane lining the inside of fibrous pericardium and covering the heart. Okay, composed of two parts, parietal and visceral layer. Parietal layer lines the inner surface of the fibrous pericardium. The parietal layer of the serous pericardium is firmly fused to the fibrous pericardium from the inside, not the outside, from the inside. Okay, the parietal visceral layer. The visceral layer, epicardium, covers the heart surface and roots of the great vessels. It covers the heart surface from the outside. These two layers are continuous and encloses the pericardial cavity, which contains lubricating fluid. So the lubricating fluid, the serous fluid we discussed back there, is enclosed, is kept within the pericardial cavity. The pericardial sinuses. There are also sinuses in the pericardium. The pericardial sinuses are the spaces within the pericardial cavity formed by the reflection of the serous pericardium around the heart and great vessels. There are two pericardial sinuses, transverse and oblique sinuses. Transverse sinus, a U-shaped cleft running transversely behind the great arteries and in front of the great veins. Oblique sinus, in an invagination formed by the reflection of two layers of the serous pericardium between the large veins. Okay, so here is the diagram of the heart layer. Sorry, there's not mention of Pleura of Pericardium, but there are the mention of two main divisions, fibrous and serous. So this is the fibrous. You can see the outer covering of the heart, and coming here, this is the serous pericardium. Okay, the serous pericardium, as we discussed, the serous pericardium is a two-layered membrane. Two-layered, not double-layered. Okay, two-layered. So the first layer, parietal pericardium. Parietal layer. The parietal layer, as you can see, this is fibrous pericardium. As you can see, this is the fibrous pericardium, and this is the parietal layer. The parietal layer, as you can see, is firmly fused with the fibrous pericardium. And on this side, this is the epicardium or the visceral layer of the serous pericardium. Okay, as we discussed, these two enclose the pericardial cavity. This right here is the pericardial cavity containing the serous fluid or lubricating fluids.